serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor, Living a Longer and Healthier Life show. Soggy South Florida out there. It's really wet, so be careful if you're driving around South Florida on the roads as well. It's just saturated out there. We were talking about that on the way in. We're going to get more tomorrow, but if you're outside of South Florida and you're watching on Facebook or other means, thank you for joining us. We're here with Doctor Jay Seidel, Podiatrist with South Florida Podiatry. I know there's a few different locations, so I'm going to first welcome you to the program and then have you talk a little bit about your practice. But Dr. Seidel, welcome to the program. How are you doing this evening?
Fantastic. Thanks so much for having me on.
And thank you for joining us. I always say on this adventure of health because we always learn so much from the great doctors that we have on. So you're based here in South Florida. Is it right here in Deerfield Beach, right next door?
Correct.
But you also practice in Maryland as well. How does that work?
So I've been practicing in Maryland for about 4.5 years, and about a year and a half ago we moved down here, and I took over for a practice, a gentleman who was retiring. So initially I was back and forth, but I have a partner now in Baltimore who's covering those offices, and I'm primarily down here enjoying the usual sunshine.
Nice. So this wasn't the intention a few years ago. You're going to just practice in the Baltimore, Maryland area, and then this opportunity just kind of, how did that happen?
We were really happy there in Baltimore. Our family's there. My wife's from there as well. But we were looking for a little bit more sunshine.
Oh, okay. Nice. Well, good move. We're glad to have you down here. I wanted to ask you a little bit about, South Florida Podiatry, and I know one of the things you have, your mission statement, your philosophy, you have your own philosophy centered around podiatry. So can you share a little bit about that with us?
Podiatry is my passion. I really enjoy helping people, but definitely our mission statement and our goal is to help people live better, live healthier, and live longer. Anything we can do to help patients move around during the day, walk, run, do their daily activities, that's really our goal, to live a pain-free lifestyle.
And a better quality of life, right?
Absolutely.
Because that's what people are looking for in the end. It doesn't, really matter. The other things don't matter, but if you have a good quality of life, and, that can help out with relationships as well. And just, being able to get up and go to work, get into that rhythm, that same thing, or being able to exercise or, go play with your kids or, have fun with your family on the weekends like, we all do. That's very important. So you taught us a little bit, told us a little bit earlier about South Florida Podiatry, but what's the brief history of how did it all come about, South Florida Podiatry?
So once we moved down here, I was really looking to find an area that I felt was underserved. I'm surgically trained, so a lot of the older doctors around in the area may or may not do surgery, so that was something that I was able to bring specifically to my practice that I started at. The previous doctor really was helping people out in the office, but we brought in some new technologies, some new surgical procedures that we can do in the hospital and out of the hospital. One of my main goals with surgical interventions is really to keep patients out of the hospital and get back to their daily life as quickly as possible and with as little discomfort and disturbance to their usual activities. We also bring some new technologies. We do lasers for nail fungus, which is a really nice non-painful treatment. We do some vein work. We can do some cosmetic procedures as well, in addition to the regular podiatry services for diabetics and wound care and orthotics and things like that.
And that's so important here in South Florida because, it's the sun is shining, most of the year, and people are out and about having a good time, so they want to make sure they're confident with how their feet and legs look as well. We're here with Dr. Jay Seidel, South Florida Podiatry, 954-426-4544, or southfloridapodiatry.com. It's South FL Podiatry, PODIATRY.com as well. What is your foot care background, Dr. Seidel?
So I did my podiatry school training in Philadelphia at Temple University. I used to brag that's where Bill Cosby went.
Yeah,
then I went on to residency training in Harrisburg at Hershey. So stayed in the Pennsylvania area. I did 3 years of surgical residency training there. And I highlighted that with some other specializations. I spent some time at the Cleveland Clinic for some microvascular
nice.
training and some reconstruction at the Rubin Institute in Baltimore. Again, then I went into private practice in Baltimore. I operated at a couple hospitals and surgery centers in the area. And then now I'm down here. I'm on staff at West Boca and the Boca Raton Surgery Center.
Okay, great. So West Boca Medical Center, Palmetto Park Road and 441. I know a lot about that because I'm involved with the Tenet Health Network. But great hospital.
Yes.
And it's growing. I know there's a lot going on out there with a new robot that they have, and I think they just renovated their OR.
Yeah, they're having a big grand opening
Yeah, I
coming
saw
up.
that. I just saw that, so that's great too, as well. So, do you do some of your surgeries in the hospital and some of them at surgery centers? Is that a decision that you make on convenience of schedule, or is it more of more of a intense surgery? So I'll do this one in the hospital versus this one. I think they can maybe even walk out or crutch out.
Sure. So some of it is dependent on the procedures. Some procedures are more involved and do require a little more advanced care at a hospital setting. But I really do, and some of it depends on the patient, how well they are, if they can handle being in an outpatient setting. But I would say 99% of the patients that I perform surgery for is done in an outpatient setting. It's a lot more efficient. They're not waiting around for emergencies that kind of creep up in a hospital setting, and there's a lot less infections. I have to say, knock on wood, I'm about 100% infection free. So I like maintaining that that level of care for patients, and I think it's much easier to attain at a surgery center.
Most definitely, we like to hear that. And you're surgically trained. Is it foot and ankle surgeries?
Correct.
Okay.
Anything below the knee is fair game.
Anything below the knee. Okay. Good to know. Once again, we're here with Dr. Jay Seidel, South Florida Podiatry, 954-426-4544, or southflpodiatry.com as well. What are some of the things that you do at South Florida Podiatry in the office right there? And I know I mentioned it before. Let me grab right here. Deerfield Beach. I knew it was right next door. It is 1874 West Hillsborough Boulevard, Suite F in Deerfield Beach. I'll give that out again.
Yeah, we're on the corner of Hillsborough and Military and Century Plaza, right next to the Century Village, Deerfield Beach. So in the office, we do a lot of regular podiatry. So whether it's, let's go through my day today. I had a 5-year-old with an ingrown toenail. I had a 16-year-old who came in for some new orthotics. I had a 101-year-old patient who came in for some diabetic foot care. We had a 72-year-old that came in with an ulcer on his foot. So it's a little bit of everything. Literally anything that happens on your foot or ankle is something that we can help you with. And everybody asks me why I like podiatry, and it's nice. You never know what's going to limp in through your door. It's punny, but it keeps you on your toes. Like, it could be any possible manifestation of skin or of bone or muscle tendon that could be causing someone trouble, and we're well equipped to handle it.
That's great to know. And I was just jotting down the ages as you were saying that, 5, 16, 101, and then 72. So you actually treat all age ranges of patients, correct?
Yeah, birth to old age.
Nice. That's podiatrist Doctor Jay Seidel. I actually, a podiatrist was one of the first specialized doctors I ever went to. Actually, I had a plantar wart on the bottom of my foot. Mm-hmm. I'm sure one of those is hobbled into your office. And then also, I played basketball, believe it or not, when I was younger, and sesamoids got all... and they had to be kind of shaved down a little bit during the season because they had gotten inflamed from, I guess, jumping so much on the balls of the feet.
Sure.
So those were, I remember that early on, like, that was between, 8 and 12 years old, both of those. And those were the first, that was the first specialized doctor that I went to, was a podiatrist. So, very important because not only younger in life, but older in life too, right? Because, so diabetes right now is running rampant across really the U.S. and then the world as well. And one of the big things, and I'm sure you're going to talk about it this evening, is diabetic foot ulcers, and then also the issue that diabetics have, they may not feel that they stepped on a tack or something around the house, and then that becomes infected, and then that's trouble.
It can get very bad very quickly.
Yeah,
so we want to encourage any patients that come in to come into the office. Let it be a 5-minute check as opposed to, God forbid, a life-threatening problem.
And that baffles me too, because I actually stepped on a tack the other day, and I knew it immediately. So I can't imagine not having that feeling in your foot.
It's very strange.
Yeah,
you come in and someone has, let's say, not to get too graphic, but a gaping hole in their foot, and you didn't notice it was there for the last 6 weeks.
Yeah,
it's mind-boggling, but it really happens on a daily basis, and it's definitely something that should be addressed by your podiatrist.
Any issue with the foot that that it looks like it could be getting a little worse, it's nice to just have a podiatrist, someone you can go to in your Rolodex in your back pocket and give them a call.
Absolutely.
And have them look at it, because with you, I'm sure you'll say this as well, with your field, preventative medicine is better. The earlier you can get to it, right?
Absolutely.
It makes your job a lot easier, and it makes the outcome a lot better.
Absolutely.
Right? Well, that's good to know. Again, we're here with Dr. Jay Seidel, South Florida Podiatry, 954-426-4544, or southflpodiatry.com. But also locations, if you're ever in the Baltimore, Maryland area, Dr. Seidel can get you in at one of his offices up there.
See one
as
of
well.
my colleagues, Dr. Van, is there, and she's excellent.
Yeah, that's nice. Baltimore, you mentioned Baltimore, and as well as some areas of Pennsylvania. These are very high academic areas.
Yes.
I've had all these doctors I've had in this show. A lot have been through Baltimore, or Temple University in Philadelphia. I mean, these are really high academic institutions.
Yeah, in Baltimore we have University of Maryland, and everyone's heard of Johns Hopkins.
Oh yeah.
And then in Pennsylvania, it's around Philadelphia. There's Temple, there's Drexel, UPenn. A lot of big colleges, big names there. Mm-hmm. A lot of great training experiences.
And then you mentioned you trained at Cleveland Clinic as well.
Right in Cleveland, Ohio.
Oh, okay. The real Cleveland Clinic, the original one.
The original one, right?
Okay. Because
I see they're down here now, right?
Yeah, they're all over the place down here, but I think they're expanding a little bit. I think that's what they're doing. But there's Weston is a great Cleveland clinic. Actually had a family member who was actually had surgery there, and I can't say enough about them. They were great.
Fantastic.
Once again, we're here with Dr. Jay Seidel, 954-426-4544, or you can get all the information at southfloridapodiatry.com. That's southflpodiatry.com as well. Got a time for, actually, let's hold that thought. Let's take a quick commercial break. And on the other side, we'll talk a little bit more about podiatric medicine with Dr. Seidel. Thanks.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Health Care.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor Living a Longer and Healthier Life show. We're here with Doctor Jay Seidel, South Florida Podiatry, 954-426-4544, southfloridapodiatry.com. That's southflpodiatry.com. Before we broke, I forgot to bring this up, but this is a great opportunity for people to be involved in a research study for venous leg ulcers. So it's evaluating the treatment for venous leg ulcers. The study includes physical examinations, wound care, compensation for time and travel. Yep, compensation for time and travel. Say that twice. At Dr. Seidel's office, South Florida Podiatry, 1874 West Hillsborough Boulevard, Suite F in Deerfield Beach. So this is for people who have an ulcer on their leg that has not healed?
Correct. So an ulcer between the knee and the ankle. We're looking for something specifically a little bit larger than a penny.
Okay.
And if you're having trouble healing it, or your doctor's having trouble healing it, or if it's a new ulcer, the nice thing about this is you're getting some new treatments, which are absolutely safe. They're approved already for the foot. We're just trying it out on leg ulcers as well. And not only that, there's no insurance, there's no cost. It's absolutely free, and we'll even pay you to come on out there. So it's kind of a win-win-win, and we get your ulcer healed quicker.
Free, and you get compensation for time and travel. Again, it's a venous leg ulcer study. So it's if you have an ulcer on your leg that has not healed, you can call 954-426-4544 or visit South Florida Podiatry. And all this info will be up on All County Healthcare Incorporated's Facebook page and their website as well under the radio tab, allcountyhealthcare.com. So that's a great opportunity. I will mention that again if you have time to grab pen and paper before the end of the program. So again, you serve a whole huge amount of the population age-wise. You said it's baby all the way up to, you said you have a patient that's 101 recently that you took care of today?
Right. As long as you got feet, we're happy to help.
Okay.
And not only that, we're happy to help you keep your feet. That was a slogan in residency. We had a race. We were supporting a race for the medical team, and it was a keep your feet race. We did foot checks and just making sure that, like we mentioned before, diabetics sometimes don't feel as well as those without diabetes, and you're definitely at greater risk for an injury that could be limb or life-threatening. So if you have any concerns with your feet or ankles, definitely should have them checked out by your podiatrist.
Yeah, and it's good to have like a podiatrist, just like you have like a primary care physician.
Absolutely.
Have someone, even if you don't have foot issues right now, it'd be a good time to just, meet a doctor like Dr. Seidel, ask them some questions and say, hey, I just wanted to come by and grab your card, and in case I do ever have any issues, I'm a weekend warrior, or, I'm out and about on the boat, it's definitely something that I've thought about recently as I get older. I definitely want to have a podiatrist, and then, you know, if I ever have any good issues, I'd like to have a good cardiologist. That's one of those things that you're kind of thinking about.
And the American Diabetes Association actually recommends seeing your podiatrist once a year.
Oh,
so
really?
even if you don't have any troubles, if you have diabetes, you should see your foot doctor and your eye doctor once a year.
Yeah, because you may notice something that could be preventative medicine that
Absolutely.
be easier, like we said before, to take care of it now than later on.
And even some systemic diseases, so some diseases that may affect your heart or your liver, can be diagnosed first on your feet. Like that can be a first presentation of a problem, and then we can help you get to the right doctor to help fix the problem before it gets worse. Absolutely.
Yeah. And as well as vascular issues, too, because I know podiatrists work with vascular surgeons. Sometimes they find the issues and then they refer to the vascular surgeon if it's needed as well.
Yeah, absolutely. Any good podiatrist will have a vascular surgeon hand in hand, so they can work together as a team to keep you safe.
Nice. That's great to hear. Describe some of South Florida Podiatry's success stories. The rabbi story, I found that one interesting. This is a rabbi that walked into your office.
So he actually wheeled into my office. It was he had a very interesting nerve disorder that left him some of his leg paralyzed, and he had to wear these painful braces in order to walk. And we proposed surgery to help him have less pain and more ambulation without any trouble and without assistive devices. And he went through with the surgery, and after recuperation, this was one of the hospital-based surgeries. He was walking on his own without a cane, without braces, at about 2.5 months after surgery. So it was one of the things that really opened my eyes to what I'm capable of to really help somebody. Like if you have somebody that comes in pain, can't walk, and they really after a procedure that's something I was able to do to help somebody's quality of life so dramatically, it was very gratifying.
And he walked out unassisted, pain-free. So that's just amazing. And another one, CariFlex. Someone had a bad toenail fungus starting from all the way back in 1987. It says right here, wow, that's something, you know, people have issues and sometimes they just let them go and they won't see anyone for a good, you know, in this case, probably 20 years?
Right, and sometimes they try and there's no other solutions where they lived or where they looked, and new technologies are constantly coming out, and I like to try and stay abreast of the new technology and the new literature to give the best and most advanced care to my patients. I think that's
what we're seeing with today's doctor. They have such a toolbox, no matter what specialty they're in. They're working with other doctors and teams, but then they have all these options to treat the same ailment. They're always thinking of, you know, should I hit it, you know, do this with this and or do it come at it this way? And you have something interesting going right into this that you offer is the laser for the toenail fungus issue.
Right, so there's a couple different treatments for nail fungus. There's some topical medications, there's some oral medications, you take a pill, but some of the new technology is now laser, so it's done in the office. It's a one-time treatment usually. The only downside is it's not covered by insurance, but it's great for people that are taking 10 medications and don't want to take another, or have some allergies to medications, or have had a bad experience in the past. It's a really great option that works really well.
So you just zap it that one time and it's just
and usually
done, right?
90% chance you're pretty good. About as effective as the medicine. Yeah. And we're actually running a Groupon now. If you look for us on Groupon, we're having I think it's 60% off. So it's a really good deal.
So yeah, they're on Groupon, and it's a toenail fungus treatment, South Florida Podiatry, using cutting-edge FDA-cleared foot laser that can change the appearance. Obviously, if anyone's had an issue like this, it's something you definitely want off your toenail.
Yes, definitely.
As well. So there's that option there. There's a Groupon option, South Florida Podiatry. Their number is 954-426-4544. Or you can go to southfloridapodiatry.com. That's southflpodiatry.com. There's a ton of info there. So you have the Groupon going for the nail treatments, which I know everyone's going to take advantage of, because we're living in South Florida and we're ready to put the sandals back on. That's a couple of days of this cool rain and we're done with it. And then you also have the option for the anyone with an ulcer on their leg that has not healed. You said you a little bit bigger than a penny?
About the size of a penny, up till
about the size of a penny.
About that big.
Okay,
So it's a
wow.
pretty big area that we're willing to work with. We're able to work with you for the trial. So it's
And this
it's
is a
really nice.
research study that you're involved in then, obviously?
Right. It's sponsored
Okay.
by a skin graft company. So that's what we're trying, this new skin graft to help ulcers heal faster.
Yeah, that's great. So it's a research study. Dr. Jay Seidel is evaluating a treatment for venous leg ulcers. The study includes physical examinations, wound care, compensation for time and travel. This is totally free.
Absolutely free
For
to the
the-
patient, no cost for their care, for their medical care. And on top of that, we'll be able to compensate you for your visit.
That's great. South Florida Podiatry, 1874 West Hillsborough Boulevard, Suite F, Deerfield Beach. You said it was on the corner of before.
Hillsborough and Military in
Hillsborough
Century
Military.
Plaza. There's a brand new CVS on the corner, and we're all the way in the back of the plaza.
Nice. And the number's 954-426-4544. Wow, you have a lot going on with your practice and practices up there in Maryland and down here as well. And
Keeps me out of trouble.
yeah, it really does. Why did you decide to become a doctor?
So I worked in a camp as a kid, special camp for kids with cancer, and it was really an eye-opening experience. And I knew then I wanted to go into some field that really helped people. And I shadowed a bunch of different doctors, and podiatry really stood out as something that, again, keeps you awake, keeps you on your toes, because it's something that's different. Every patient is different. I'm not just seeing bones or just seeing skin or just one type of ailment. It's really a wide variety, and it's a wide variety of patients as well. Like I mentioned before, from birth to 99 plus, we're seeing all age patients with all types of problems.
That is amazing. And every day it's something different walks through your doors.
Yes.
And that's what keeps you going. Again, it's Dr. Jay Seidel, South Florida Podiatry, 954-426-4544. Get involved in that leg ulcer research study, or talk to him about, getting those nails cleaned up and getting back on the beach. Thanks again, Dr. Seidel.
Thank you for having me.
See you next time, the You and Your Doctor Show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.